Well, our first interview with the oncologist and nursing staff, we were given verbal information in detail about what to expect, and we were also given a booklet and some literature to read, which we read thoroughly, and I think that we went in pretty much eyes wide open because what was made available to us gave us a really clear understanding of what Kevin was going to face or could encounter. So really our start was through the hospital.
You've got to listen and try and take in as much as you can. It is difficult because you're not in a good headspace at times, but you've got to take in and listen to what they're telling you. And
immunotherapy is administered in a day therapy centre. So patients are given an appointment. They know when they're going to have their immunotherapy. Their the first appointment will usually be twofold. It'll be to educate the patient regarding what's involved in the immunotherapy, going through it very clearly step by step. And if patients are having a cannula or a drip put in, they're told what's involved with that, what the infusion looks like. It may be the very first time people have ever had an infusion. So they're given in a day therapy area in a chair that's a safe place.
Yeah, to make it for people that are going to start this immunotherapy, they're lucky that they've got the nurses that they go and see are very good. They're the ones that'll start everything off, and they'll explain to you what they're going to do. So I found that quite good, and they'll do that as you get each treatment. And as I said, you'll see your oncologist first. He makes sure that the blood tests and everything you've got to have before you can start the treatment have come and they're all okay.
I think that keeping in mind that all of the things that are happening behind the scenes is really to make sure that everything is focused around that patient, to make sure it's absolutely safe for the treatment to go ahead. So sometimes that can result in delays, but those delays are, they're absolutely necessary to ensure the safety of the patient. Pre-treatment bloods are bloods that are taken before treatment, as the name implies, and it's looking at lots of different things that can identify if there could be an issue with the safety of proceeding with the treatment. So it could include things like your liver function, could include things like your thyroid function, and so forth.
Also, there are regular blood tests associated with the immunotherapy before each of the infusions. And so those blood tests picked up some other things that were happening in my body that were not obvious to me and that I wouldn't have been able to report on to the nurses, to my oncologist, but enabled my oncologist to say, look, we've got a bit of a problem here and we've got a few more decisions to make about continuing or having a break, or what do we do at this point.
For my first session of immunotherapy, I found taking someone with me was really, really important. It was someone to talk to while I knew that I might be waiting for quite a while. Especially on your first dose, they like to keep you there for an extra amount of time. So I took my mum with me. And I also took things like my laptop. I had, I think, Netflix or something, and I made sure I had pre-decided what TV show I was going to absolutely binge watch the entire day. And it was just making sure that I had things to do and things to keep me occupied and distracted from, my first treatment.
I had a small DVD player, and I had 2 DVDs. And it didn't matter what it was. I plugged the DVD player in, watched it, put my arm out, and just sat there and enjoyed it.
When Jim goes in for his infusion, I always go with him, and I do get a bit prepared. I usually take my knitting in with me or a book, because it can be quite a drawn-out procedure. So yeah, I usually do take things to keep myself occupied.
If you're going alone, even just talking to the nurses, or I know with my experience, I was treated in a room with, I think, 6 other people, and they all get what you're going through. They may be doing chemotherapy. I think a lot of the people in my room were on varied treatments, but they're all in that same boat with you. And it was quite nice to have a conversation with someone who actually got it.
Oh, we just go for a wander and, have a coffee, have a croissant when we arrive, make a day out of it, make it as easy as possible. And we know it's taking a while before the drug is made. Yeah. So we just, share the time together and, something, make a day out of it, more or less.
Just ahead of that as well, just having a think through of the day. So if you need to know, well, how long is it going to take to get there, and where are you going to park, and those sorts of things. So that way you're doing things and planning out the day. So you're just reducing the chance of any stress throughout the day, because you're not going to be able to control everything, but you can control how you prepare for it.
Your first time in there for treatment, it's a bit scary because you don't really know what to expect, like any new thing. But you trust that your treatment that you're going to have is going to help you, and so you just need to trust that it'll work and that you'll enjoy it. Don't think like it's an intrusion in your life, that I know it is stopping you from doing what's been normal, but this will become your normal, and it's a great thing because it means you'll be here for as long as you can be.
I think a really good piece of advice is to drop some of those expectations around time and to say, well, this morning, this afternoon, today, this is what I'm doing.
You can sit there and do anything you want to do. You can actually then even leave there. If you want to go to the toilet, you can, they'll disconnect the what's the name and you can go to the toilet. So you're not restricted in any way, as I said, but if you want to read your iPad, and some people read their books, their iPads or whatever like that. So you're not restricted in any way. It's just totally relaxing, and the nurses come and help you out and everything like that. So,
Well, we encourage people to ask questions, as I said, and we'll try to gain that understanding. So if people aren't asking us questions, we'll try to ask questions to get them to think about different things. So it could be something as simple as, well, how are you going to travel into the hospital for your treatments? So with that is part of the treatment that they're completely in control of. How are they going to be managing at home? So are they going to ask some friends or family members for help with meals or what have you? How are they going to manage that whole part of their life that is outside of the hospital? And that really is within their control. So perceiving that as something that it is something that they can control, we can help them think about what those things might be. So that way they can see that, well, it can feel like they're out of control, but there's actually lots of elements of this journey that they can control, and encouraging them to do that.